I want to get kind of your perspective on just kind of what's going on with health right now, because that's what we're here. We're here to help people, guide them through health challenges. You know, we're going to get into a little bit of myths versus facts later on, but I kind of want to kind of get your guys' perspective on just really what's going on with the state of health. So I'm going to ask this question to Lily. I'm going to put you on the spot right now. Here you go, Lily. So here's the question. What is your general thought process about, you know, the chronic disease burden that we're seeing on a day-to-day basis in the typical average adult lifestyle? I mean, where are we at? What do we need to do?
So I think a couple of decades ago, it was still patients were coming into the office to treat an illness, to treat a chronic illness like asthma, diabetes, hypertension, and they would only come when they were sick. I think medicine now is striving more towards a preventative method, to where we're having patients come in before they get sick. We're teaching them how to prevent hypertension, prevent diabetes, and if this is something that they're going to have, how they can treat it and live longer, happier, healthier lives. I think that's where the main point is right now, is preventative medicine more than just coming to see us when they're sick.
Joe, thoughts on that?
I completely agree with that. I mean, I think you know, the obvious question is, or the obvious conundrum is, you know, how can we do more with less, essentially? And you know, anybody who's a nurse or works in healthcare understands that, you know, budget plays a big role, whether we like to admit it or not, in how we care for our patients. And so the more we can do in the outpatient arena, and even in the inpatient arena to some degree, you know, as far as education goes, and treatment modalities and all that kind of stuff, preventing the readmission is huge in this day and age. And yes, things like insurance have things to do with it as well. But you know, from a truly caregiver standpoint, I think that you know, education and preventative measures really do play a bigger role now than they ever did before.
You know, I think about how with me, when I first started in my clinical practice, yeah, we kind of, this is 11 years ago, we really kind of had this, we'll wait for people to come to us, but we're so much more, at least in primary care, I can speak about it, that we are so much more we have. We know all of our diabetics, for example. Yeah. We know all of our patients that have high blood pressure, and we're actually reaching out to them versus them waiting for something to happen to come and see us when something goes bad. We're saying, no, we're going to reach out to you now, get you in on a schedule every 3 months or whatever, but we're going to pull you in so we can make this short-term sacrifice so we get the long-term gain, and that long-term gain is not ending up in the hospital, and Kathy's got to take care of you because she's working in the ICU, and you're in really bad health. And so we're really trying to do that. You know, the reality is we still live in a very disease-driven model, and that's really, disease helps pay the bills around in our healthcare system. And so, you know, we really have to have this kind of collective mindset. Fred, let me ask you this question. How do we create more urgency in our communities to live healthier lifestyles? What's your thoughts on that?
I think it's all about education, and that, you know, I think nurses play a big role in education, just, you know, teach them the right. Even right now, because we have internet, it's very easy for patients to access information. It's just on us to route them to look for the right information. You know, I can speak about like myself with the Hispanic community, you know, and the problems with chronic diseases, and you know, the importance for them to understand that a healthy diet is not always a traditional diet, you know, like just or like a cultural diet, like I don't know if that's a word.
I think it's a word.
but a healthy diet, basically. So yeah, I mean, education is just the priority. You know, that's how you maintain a healthy lifestyle.
Kathy, you see a lot of people obviously on the inpatient side, and again, from our experience working together many years ago, many moons ago, we're both, by the way, we both have aged gracefully during this time. I got to just say it. We've aged gracefully, there's no doubt. But, you know, I remember our days in the ICU together, and you're seeing the end result of disease, and you're still seeing it right now. What's kind of your perspective on things as an ICU nurse? You know, what do we need to do to help prevent people from coming in your door?
That's a really good question. I think it comes back to what Fred was saying. It's all about education. You know, I think people think, oh, well, you know, if I get this, there'll be a pill I can take for it or a shot I can take for it, and, you know, not understanding. No, we can prevent all of that altogether if, you know, with some lifestyle modification, or, you know, if we do get to the point where you do have the diagnosis, there are things that can keep you out of the hospital. You know, and unfortunately, there's still a lot of education that needs to happen.
Yeah, I know. And I think that's why I wanted to create this kind of show, to have this kind of forum to talk about it, but also for those that are out there listening to us, watching us on intellectualradio.com or watching us on Facebook Live, really to say, hey, you know what? These are people that care. They're trying to say, hey, I got to create some urgency. And again, every day is an opportunity to be intentional. We all get the same 24 hours. It's a matter of what you do with them. Yes, we know we have obligations. A lot of us are raising families or taking care of our older parents, or we're busy at work, not a lot of time. You're trying to figure out how am I going to make this 24 hours work. I'm grinding day in and day out. But we have to somehow put health in the forefront and really go from a reactive approach to a proactive approach. Because we know as you continue to have success in your health, you're more likely to have success in your life. And really your health journey is just part of your life journey. Let's tell our story. Let's make it successful. Let's live healthier and happy lives. And that's what we're talking about today. Again, I want to help move the needle, and what you guys are doing is amazing to try to help create that sense of urgency. So I want to ask this question to Joe.